Thinking about opting in on GLP-1 weight loss drugs? Well, consider this. As the drugs become more popular, so have lawsuits against the drug makers. Over 3,000 patients have filed claims alleging severe side effects. This includes blindness, even brain dysfunction. Here to discuss this is medical weight loss expert, Dr. Sue Decotiis. Doctor, always good to see you. Welcome back.
Good morning.
I mean, when you think about the amount of Americans, more than 31 million people in the U.S. are taking these medical weight loss drugs. What are the listed side effects?
There are many side effects, and so many people are concerned. I mean, I do video and in-person consults in my office. I'm getting so many requests for people calling and saying, what do I do? My husband's on this drug. He's a diabetic. I'm concerned. Well, the most common side effects are nausea, vomiting, diarrhea, constipation, an extreme feeling of fullness. But the complications are different. So the complications include gastroparesis, where the stomach really just shuts down, intestinal obstruction. That is very, but again, those are pretty rare and they are treatable. And there have not been any deaths associated with these complications. So that's something to realize. Sure. And then, of course, the blindness is scary. And some of that may not be related to the patients being diabetics. Many of the patients that have these complications are diabetics. Keep that in mind.
And that is an important note.
Yes, very important to note, because part of diabetes destroys the nervous and the vascular system. So if a diabetic develops gastroparesis, that's common. And he or she can develop that even if they're not on the drug. So it will be interesting if they can prove that it was directly caused by the medication. So if you don't treat the patient with type 2 diabetes and they would have responded well, they could get this side effect anyway. So
yeah, you mentioned
it's important to note that.
That eye stroke that eventually led to blindness. That does sound scary. Talk to me, Doc, about the rare side effects. And I was going to ask who is more at risk, but is it mostly then the diabetic patients who are on these meds?
I think the diabetics are definitely more at risk for this quote-unquote eye stroke, which is known as NION. And it kind of occurs out of the blue. There have been some weight loss patients that have experienced it. But again, this is very, very rare. So I think that, especially for diabetics, they should be seeing an ophthalmologist for dilated eye exams a couple of times a year anyway, you see? And that's certainly a way to prevent it. But yeah, I mean, in medicine, it's always risk versus reward. You don't want to keep somebody off a drug because of a rare potential side effect or complication. You want to say, what are the benefits? And then the physician and the patient weigh those together. And unfortunately, so many patients are not getting proper care.
Right.
It's very important for the patients to be very well hydrated. That has to be monitored. They have to be on the right dose. They have to be eating enough protein. Most of the patients with these GI complications were dehydrated to begin with. In my practice in New York City, I'm monitoring people with a body composition scale. So I know if they're doing what I want them to do. But patients that are not accessing good care, maybe they're getting these drugs on an online platform, or they're just seeing a healthcare provider that's rubber stamping prescriptions. Yeah. They can run into problems.
Doc, as a medical weight loss doctor, expert, when you see an increase in lawsuits like we're seeing now, what's your message to patients that are on these drugs?
Lawsuits do not necessarily reflect what actually is going on. I think this is a very, very safe category of drugs. I just think that see the right physician, make sure you're hydrated, make sure you're getting the right kind of care, demand that for yourself. I don't think actually that when you consider that we probably have more than 30 million people on these drugs, that 4,400 people have filed lawsuits. I mean, as we know, lawyers are circling around like sharks sometimes, and they're going to jump on this bandwagon. That doesn't necessarily mean that these drugs are more risky.
I'm looking at the claims in some of these lawsuits. 75% of patients allege developing stomach paralysis. Right. Do these lawsuits affect how you choose one medication over another?
I think that if the patient's a diabetic, they have to be monitored carefully. If they have a history of GI problems, they should also be followed by a gastroenterologist. But most of the patients that I have heard about that have this gastroparesis, a stomach paralysis or intestinal obstruction, are patients that were dehydrated. So that's something, I think a lot of this is preventable. And even if they develop that, most patients recuperate from that by discontinuing the drug for a while or permanently and getting rehydrated.
Doc, let's say there's a patient, they're considering taking a weight loss medication. Again, over 30 million Americans are taking these GLP-1s. Just how early are they made aware of the risks?
I know that the FDA insisted that they put an intestinal obstruction warning on the warning packs. And I think that every patient should really review the side effects with the physician. And then if something arises, if they're seeing their physician frequently or speaking to them on the phone, this can certainly be discussed. But I don't imagine that, I don't know how well these suits are going to go. But I believe that this should not discourage people from going on these medications if they can't lose weight on their own. That's the key.
That is the key. And so many Americans, again, are on this medication or at least thinking about getting on it. Dr. Sue Decotiis, thank you. As always, stay warm, Doc.
You're welcome. Thank you.